months that you've been feeling tired and years that you've been working really hard with not enough sleep, last week during the last meeting of the day you felt hot, your heart was racing, and you felt like you were running on adrenaline. Usually when you feel this way, a snack does the trick, but this time it seemed to last longer. In addition, you often feel spacey, like you're floating on top of conversations versus actually being in them. Today, you felt like you're running on adrenaline again and you were feeling very anxious. Welcome to Revivelife and our show on anxiety. Although it's normal to feel anxious from time to time, if you feel anxious without reason and if these worries persist and affect your day-to-day life, you may have generalized anxiety disorder. Symptoms of generalized anxiety disorder include restlessness, feeling tense or on edge, irritability, impatience, or poor concentration. Other common complaints that people may have and may not recognize that it might be related to anxiety are headaches, jaw pain, muscle tension, difficulties falling or staying asleep, dry mouth, fatigue, chest tightness, indigestion, bloating, excessive sweating, and headaches. Recognize any of these? It's important to be evaluated by your doctor for a proper diagnosis and to rule out any other medical problems that may resemble anxiety. Anxiety disorders are the most prevalent mental illness condition affecting Canadian adults. 1 in 4 Canadians will have at least one anxiety disorder in their lifetime. There are 6 recognized anxiety disorders. Number 1, generalized anxiety disorder. Number 2, panic disorder or agoraphobia. Number 3, post-traumatic stress disorder, where stress plays a component. Number 4, social anxiety, which is anxiety specific to social activities, and obsessive compulsive disorder. Specific phobias all have the common characteristic by intense fear, anxious arousal, irrational thoughts, and avoidance. Research shows that 3.4% of Canadians experience these disorders at serious and chronic levels which interfere with the quality of life and ability to function academically, at work, and in social situations. It's not uncommon for anxiety disorders to be present with other conditions such as depression. It is important for us to recognize anxiety disorders in our youth, as it is a significant risk factor for the development of depression and substance abuse in early adult years. Anxiety disorders are also associated with a 10-fold increase in suicide risk. Our quiz for you today is: can anxiety be related to fatigue? Can exercise help reduce anxiety? Can anxiety be related to the adrenal gland? And can hypoglycemia make anxiety worse? A few tips to help prevent anxiety include: ensure you're getting a minimum of 8 hours of sleep to reduce excess cortisol, which can aggravate anxiety. When the body is in a nervous system sympathetic dominant state, an overproduction of fight and flight hormones, including epinephrine, norepinephrine, adrenaline, cortisol, can certainly aggravate anxiety. So try taking a break midday to help reduce these hormones. You can simply put on your iPod and listen to some great tunes, or catch 10 minutes of fresh air with a walk. An overactive adrenal or overactive thyroid gland may contribute to your anxiety. Check with your medical team to rule this out, and keep in mind the new normal range of TSH, which is 0.35 to 3 micro-IUs per ml. Other hormones that may impact anxiety include low progesterone and high estrogen. PMS, perimenopause, or menopause may be high-risk times, so I recommend having your hormones checked. For men, low testosterone may also be associated with increased risk of anxiety or tension. So if you're experiencing anxiety, speak to your healthcare team and have your hormones checked. When it comes to food, make sure you eat and hydrate every 3 hours to keep blood sugars even, as low blood sugar may also contribute to anxiety. Our snacks for you today revolve around smoothies to go. Number 67 on our 101 snack list is banana, coconut milk, and lemongrass smoothie, a smoothie to reduce stress related to high blood pressure that often can come with anxiety. Bananas are high in potassium, which help your blood pressure and heart. Rich in calcium and magnesium, coconut milk supports the adrenal glands, and lemongrass contains manganese, which helps the nervous system healthy and keep stress at minimal bay. Simply blend 2 frozen ripe bananas, 2 cups of coconut milk, and a stalk of lemongrass. Number 68 is an avocado, broccoli, and bok choy smoothie. This creamy green juice can help lower blood cholesterol, which is often caused by stress. Avocados are a great source of calcium. Broccoli helps to induce muscle relaxation, and it's loaded with the antioxidant beta-carotene. Bok choy also helps the body deal with stress hormones. This one simply has broccoli, bok choy, avocado, some fruit, and a little bit of honey. Lastly, banana and peanut butter smoothie. This protein-rich smoothie replenishes both mental and physical energy. The carbs in the banana help to stabilize blood sugar, while the potassium helps the brain be more alert. Peanut butter contains more than 25% protein, which is important for energy, as well as resveratrol, which can help protect your memory. Almond milk, a great source of slow-burning energy, and contains B vitamins important for energy production. For this recipe, just take 1 frozen banana, 1 tablespoon of peanut butter, 2 cups of almond milk, and a tablespoon of chia seeds. Coming up shortly, we're going to be talking more about anxiety and natural wellness tips to help you through it.
Okay, thank you. Hi. Do you have a preference?
Yes, just either. Back to Revive Life and our show on anxiety. Many times life can just get too serious, so a couple more tips to help reduce anxiety for you are: lighten up your life by watching a funny movie or catching some funny videos, as sometimes laughter can be the best medicine. Don't forget your furry friends. Take time to play with your pets. A laugh with Fido can help melt away stress and reduce anxiety. Connections are what helps to prevent depression, including those with your pets. Our first guest is from the Anxiety Disorders Association of Ontario. Welcome, Ashley Smith.
Thank you. Thanks, Jason.
So please tell us what the organization does and what its role is in the community.
Sure. Anxiety Disorders Association is a nonprofit registered charity. We've been in the Ottawa community since the late 1990s. And basically what we do is we offer 14-week programs, psychoeducational workshops, to teach clients how to manage anxiety on their own, teaching them skills and tools to do that. We also do have a toll-free information line, and we do community presentations. So
wonderful. Now, do you need a referral to come to your center at all?
No, not at all. No, it's self-referred. They just have to call in and speak to the office coordinator. Me.
And is it just orientated towards adults, or is it for children as well?
18 years and older.
18 years and older,
Yeah.
okay. For those individuals that may be sitting at home thinking, you know, I'm not sure if I have an anxiety disorder, you know, I feel stressed or I feel overwhelmed, but really, what is anxiety?
Anxiety, I think the first thing to understand is that anxiety is actually a relatively normal reaction. I think we all experience it from one degree to another. So for example, many of us will be anxious if we go and do a presentation in front of a group, or we go into a really important job interview. But an anxiety condition is different in the sense that it's longer lasting, it's more intense, it gives you with a sense of like powerlessness, and it affects their everyday functioning.
Yeah, so the most significant difference is it lasts longer and then it impacts your lifestyle is essentially.
Absolutely.
Yeah, the avoidance aspect is a really important
It's
component.
huge, and it's the reason why it continues is avoidance. So.
Exactly. Now, what is the difference between anxiety and panic?
Okay, so panic is a very intense, brief duration period of apprehension or fear. So it's very intense in the sense that a lot of the symptoms are very similar, but it's really overwhelming. So some of those symptoms could be shortness of breath, rapid heartbeat, like a feeling of dizziness, all kinds of stuff. It's different for everybody, but it's really, really intense in that moment. And as a result, they often feel like they're having a heart attack, or they might, or fear of dying, right? And it's really hard to identify what that is for them, especially if it's the first time it's happening.
Well, that's an important point, because some people may think that they're having a heart attack and end up going to the hospital. Is there any tips or guidance that we can give our audience to help them understand perhaps a little bit about the difference between panic and having a heart attack?
It's very similar symptoms, right? So it's a completely justifiable reason why often they feel the need to go to the hospital. I think what it is in the past we've had clients who went through the whole testing to make sure that that's not the case, so they can clear their mind of that to help them with it. But for them, mostly in the moment, it's about using relaxation techniques, so deep breathing skills, to really calm themselves down in the moment so that it's not, they can work with the physiological symptoms first and see if they continue after they've done those skills and strategies.
Yes, that makes sense. You know I've had clients where they actually have had a history of having a family member have a heart attack at a certain age, and then when they hit that age, they actually start recreating the symptoms.
Yeah, absolutely.
And it's really, in that scenario, of course you always want to go to your doctor and double check, but in that scenario, it's actually an anxiety related to a condition, and then they're recreating it.
Absolutely.
Yeah. So other aspects of anxiety is, you know, we've got men and women. Do you find that there's a difference between the frequency that anxiety may occur?
I think in terms of what we see come into our center, it's really relatively similar in terms of the amount of men and women that come in. But what I do notice is that women are far more likely to reach out for help. I think that in terms of who has anxiety more, it's the same, but it's more that women reach out first. I think there's more of a stigma for men to reach out for mental health concerns, anxiety included, so I think that's a big part of it.
So if somebody is sitting in the audience and they think that they might be experiencing a generalized anxiety disorder, what should they really be doing?
I think the first step is probably talking to your family doctor about your concerns and seeing how he can help you. Like I said, we have a toll-free information line, so if anyone wants to talk further about it, they can always give us a call and we can kind of go through what's going on with them at the moment. There's tons of resources in the community out there. It's just about doing your research and finding out what they are.
And for those individuals that are resistant to medication, what would your feedback be for those individuals?
I don't believe medication is, and the stance of our center is that medication isn't the only way to go. Often we find people who come in who are trying to wean off the medication worked for a period of time, but now that they're weaning off of it, the anxiety symptoms are coming back because it hasn't fixed the problem, right? And not that I think anxiety is curable per se, but it's manageable. And so if you learn the skills and tools that are out there, so deep breathing relaxation techniques, learning cognitive behavioral therapy strategies, and put them into place, I think that you can actually get to a point where you don't need to be on medication to control it.
Exactly. I find that with the individuals that I work with, sometimes it's a function of helping them understand what their pillars are and their pillars of health, and we'll just go through sort of 5 pillars that are very important, and then to make sure that that is happening in their life. Because sometimes one of the foundational pillars might be just having some downtime,
Right.
and the person is just really overworking themselves, and it's a very simple lifestyle function that could be self-corrected.
Right, and there's a lot of just simple things to do, like changes in your diet. It's a big one. Exercise is another big one, for sure.
Exactly. For those individuals that are experiencing obsessive compulsive, because that's one form of anxiety.
Yeah.
So today we're talking about generalized anxiety, but how do we know when somebody, because there's all forms of spectrums, you know, some people might just have to go check the stove a couple times to make sure it's off. How do we know when it's evolved to something that's much more extreme?
I think if you're like a family member of somebody who's concerned, it's really to look for how it's affecting that person's daily life. So
Yes.
is it something that's hindering them from doing the things they want to be doing? So in that case, for example, they want to be leaving the house and going and participating in social activities, and they're not able to because they have to keep coming back and doing those compulsions to feel the anxiety released before they can do anything. So if it's inhibiting in major ways, it's definitely a sign to be concerned and to move forward with looking for some help for them.
Exactly. I find the brain also, the way I help